I'd like to welcome you to this virtual event today. Many of you have joined us in person previously, and we're delighted to be able to continue to offer this service. First, I would like to thank our sponsors today, Kaiser Permanente, Humana, Cigna, and Integrity Insurance. In addition to that, the Centers for Medicare and Medicaid Services have joined us today. We are especially grateful for all of those agencies being able to come together today to provide information to you. The first thing I want to do is spend a few minutes helping you to understand the platform that we're using today, which is called Hop-In. So up here in the left-hand corner, you see this big one with a red rectangle around it. The top button is just the logo for Hop-In. The next one is like a house, and that is called the reception area. The next one is like a camera, which is the stage. And the bottom one is like a little tent, and that is called the expo area. On the right-hand side, we have a big 2 with another rectangle that says chat and polls. And if you want to put something in the chat, and you can see people have started to talk to us, there's information in here, you receive a call, whatever. If you want to put something in the chat, you can go down here to box number 3 and you can type something in there and you can hit return, and then we will get your message. The next area that we want to look at is, as you can see, it says the stage here. The blue camera has come on, and here is my picture. And in a little bit, when we start talking, we'll be talking from the stage area. The third thing that you can pay attention to is the exhibit area or the expo. And as you can see, this first one is our exhibit booth. The second one is Medicare, the Centers for Medicare and Medicaid Services. And the last one is Humana. If you click on this, then you will see that it says the presentation will start shortly, and I will return to this screen once we finish with the lecture. If while we're in the exhibit area, you want to talk to us, you can hit the booth over here. You see it says number 2, and it's switched to booth. And then there's a chat, there's also polls, and if you want to send us a message or whatever, you can hit the chat, and then we'll be able to talk. The other thing is that if you want more information about something, you can click the blue button and type in there. So for example, if you want CMS to send you more information about dialysis, you click this button and then you type in there and they'll be able to send you information. So let's go ahead and get started here today on this Medicare Monday. Social Security is the first thing that we usually start with, and we start with that because the cost of living adjustment, which has been announced recently, is going to be 1.3% in 2021. That number helps to determine what the Medicare Part B premiums will be. The second thing that I want you to know this today is that Medicare has parts. As you can see, it has parts A, B, C, and D. And what we supplement Medicare with is called plans. And we have Medicare Advantage plans, we have Medicare Supplement plans, and we have Medicare Prescription Drug plans. So let's dive right into Medicare Part A, the inpatient care for hospitals and rehab, as well as home care and hospices. So Medicare Part A, the deductible for Medicare Part A has not been released, nor have the coinsurance for days 1 through 90. Basically, all you pay is the 60 is what you pay is the deductible. Days 61 through 90, we're projected for $363 per day. After days 91, when you go into lifetime reserve days, they're looking at $726 a day. A deductible period is basically every 60 days. If you have been in the hospital or the skilled nursing facility for 60 continuous days, you have one benefit period. It starts over every 60 days, and every 60 days you having new deductible amount, which is projected to be $1,452. Primarily, most people do not pay that out of pocket. It's paid either by a Medicare supplement or it's paid by Medicaid. If you're in a Medicare Advantage plan, it's paid differently. Medicare Part A is free for most people who have paid into Social Security. The benefits of Medicare Part A are hospital and mental health inpatient coverage, as well as skilled inpatient rehab in a skilled nursing facility, usually skilled home health care and hospice care. So if you are in a hospital as an inpatient, you have to be admitted. For you to be eligible for Medicare Part A home care or skilled rehab, you have to be in there for 3 midnights. The hospital is required to confirm your status each day. So if you could be an inpatient and then eventually move to be an outpatient, even if you're in a room. So it's important that you know that what your status is every day. If you go to the emergency room, you are in an outpatient status. They can only hold you in the emergency room, though, for 24 hours. If they hold you longer than that, they have to give you a Medicare outpatient observation notice or a MOON, and you have to sign that to agree. In addition to that, when you're in the hospital and you're getting ready for discharge, they have to give you an important notice from Medicare, and that has to be signed by you as well, giving you information about your hospital discharge. If you feel like you're being discharged too early from a hospital, you can file an expedited appeal. If you go to a skilled rehab facility and you have 3 midnight stay and you need skilled services, days 1 through 20 are free. Days 21 through 100, the co-insurance is projected to be $181.50 per day. If you need skilled rehab more than 100 days, then you have to pay 100% of the cost. Home health care can be either a Part A benefit or a Part B benefit. In order for it to be an A benefit, you have to spend 3 days in the hospital. You have to need skilled services such as wound care, therapies, skilled nursing, and you have to be homebound, meaning that it has to take extraordinary effort for you to leave the home unless you are going to church or unless you are going to an adult day program. The cost for home care, if it's an A benefit or a B benefit, is $0. The last benefit under hospice care under Part A is hospice care. You must have a terminal diagnosis from a physician which says that you have 6 months or less to live. You're initially authorized for a 60-day benefit, followed by a second 60-day benefit, and then a 90-day benefit. During this time period, your condition must be deteriorating for you to continue to receive hospice services. Some people who do not deteriorate are discharged from hospice. Hospice services, again, are at no cost. Hospice services include nursing services, chaplains, physician services, medication, social workers. You have to pay 5% for the cost of the prescriptions, and you also have to pay 5% for respite care. So if, for example, your loved one who's on hospice goes to a nursing home for 3 or 4 days so that you can rest and recuperate, you would pay 5% of that cost. If you are in an assisted living or in a nursing home, you have to pay 100% of the room and board if you are on hospice care. So the next thing let's take a look at is Medicare Part B, which is outpatient services. The premium for Medicare Part B is projected to be somewhere between $146 and $153 per month. Your Part B premium, as well as your Part D premium, is determined based on what your 2019 adjusted gross income taxes were. So if your adjusted gross income tax is $88,000 or less, and this number has increased by $1,000, and you are single, you'll basically pay the estimate of 146 to 153, and your Part D will be your monthly premium depending on the plan that you select. If you are a couple, basically you'll pay $176,000. If you're you won't pay, I'm sorry. If your adjusted gross income for 2019 is less than $176,000 as a couple, you will pay the $146 to $153 per person for your Part B premium, and your Part D premium will be based on the plan you select. If you make more than that, then you'll need to check with this chart. Under Medicare Part B, the deductible has also not been released. It's projected to be about $212. It's paid once a year on the first $212 of Part B expenses that you incur. After that, Medicare pays 80% of the approved charges, and you pay 20%. In addition to that, if a Medicare provider does not accept assignment, meaning they take your 20% and Medicare's 80%, they are allowed to charge an additional 15% called an excess charge. So an example of this is if you go to the doctor's office and they charge you $100. The Medicare approves 80% or $60, which is 80% of $60 is $48. That's what they'll pay. You then pay 20% of $60 or $12. If the doctor accepts assignment, they'll accept the $60 as payment in full. If they do not, then they're allowed to charge an additional 15% of the approved charge, which is an extra $99, and then you'll be charged a total of $21. There's no annual limit on Part B, but most of this usually is paid by a Medicare supplement or by a Medicare Advantage. Medicare Part B providers are being required to be much more transparent these days and are giving you an estimate of the costs that they will be charging prior to actually delivering the services. If they feel for some reason or other that the service may not be covered, they may ask you to sign an advanced beneficiary notice of non-coverage. And what this means is that if Medicare does not pay, you agree to pay the price in full. This is a rather busy slide, but what we wanted to do was let you know that there are a wide variety of services that are covered under Medicare Part B. So for example, we cover physician services, we cover labs, x-rays, chemotherapy, home health services, vaccines, etc. We've added a couple of new services to Medicare Part B this year. One is e-visits. That has come about primarily through COVID-19, in which we're now covering telephone visits, we are covering tablet visits, or we are covering visits on your computer. Doctors can get paid the same amount as if they saw you in person. We're also covering at this point in time much more telehealth, and this again allows people to be seen in their own homes. It allows certain kinds of procedures to be covered as well, such as reading different kinds of blood pressure or heart monitors and those kinds of things. It also is allowing for virtual check-ins. Medicare Part B covers immunizations. Sometimes Part D covers immunizations as well. So if you get a flu, a pneumonia, or a hepatitis B shot, You usually get that at the doctor's office, a community clinic, or your pharmacy, and that becomes a B benefit. We advise you to get our shingle shot or a Tdap booster at the pharmacy, and that is a Part D benefit. The reason you get those at your pharmacy is that they are charged to your Medicare Part D plan, and you may have to pay a copayment depending on where those vaccines are on your Part D tiered system for your prescription drug plan. Another way to look at who pays for drugs in terms of whether it's a Part B or a Part D charge is if you get the vaccine or the drug at the doctor's office, then, or at a hospital outpatient setting, and it's given by a skilled person, such as a cancer drug or an ESRD drug, then it's going to be a Part B benefit. If you get the prescription filled at your pharmacy, if you take it home and you give it to yourself, such as a heart medication, then it will be a D program or a D benefit, and it will be subject to whatever your Part D plan requirements are. End-stage renal disease or dialysis is another B benefit. It's due to kidney failure if your kidneys are functioning at about a 10 to 15% output. Dialysis is an outpatient benefit, and it becomes, Medicare pays for it depending on basically what your insurance was prior to your diagnoses. But for the most part, dialysis and kidney failure is paid for by Medicare. Durable medical equipment is another Part B benefit. Every one of these different durable medical equipment types is walkers or wheelchairs, hospital beds, or whatever. There's a competitive bid supplier who is a national supplier that contracts with local agencies. You have to get your services through one of the approved bidders for Medicare to pay for it. They do have to accept assignment, meaning that they cannot charge you more than the 20% copay. You do need a doctor's order that it is medically necessary. Sometimes we have durable medical equipment that is rented and then eventually purchased. So for example, a wheelchair or a hospital bed, you rent those, and then if you rent them for a certain period of time, then basically they are converted to a purchase arrangement and you own them outright. Incontinence products are things that are not purchased under durable medical equipment. Mental health is another benefit that is paid for under Medicare Part B. You can have a visit to any type of mental health professional, such as a psychiatrist, a psychologist, a social worker. They'll cover screenings, they cover therapy, counseling, diagnostic evaluations, as well as medication management and partial hospitalizations. These mental health services are subject to a Part B deductible. So once you've paid that for the year, you don't have to pay it anymore. And then you have to pay the 20% copay, usually paid for by your Medicare supplement or Medicaid. Now, let's take a few minutes and let's talk about Medicare supplements, or sometimes it's called Medigap. Medicare supplements basically allow you to see any provider in the United States who accepts Medicare. This could be a hospital, a doctor, specialist, nursing homes, etc. There usually are higher monthly premiums based on when compared to a Medicare Advantage, but on the other hand, you have almost no out-of-pocket expenses. You do have to buy a standalone prescription drug plan, and you don't have to have any referrals if you want to see a specialist. Now, the really important change that I want you all to know about in terms of Medicare Part B is that in 2021, actually in January 1 of 2020, the federal government said that insurance agents could no longer sell a Plan C or a Plan F. Now notice we're talking about plans. So we're talking about Medicare supplement plans. Now you have two choices. You can stay in your Plan C or F, and it will continue to cover your Part B deductible. Remember, we are expecting that that will be around $212 in 2021. Most likely, however, because these insurance pools will decrease over time since we cannot sell new plans, your premiums will increase as the insurance pool decreases. You can call in the state of Colorado, you can change from a Plan D if you are on a C, or you can change to a Plan G if you are in an F, but you can only do this from January 1, 2021 to June 30th, 2021, and you can do this without any underwriting, regardless of your pre-existing conditions. We highly recommend that you do this to keep your premiums lower. The companies that are selling Medicare supplements in 2021 include this very long list. It's important to know that the basic Plan G coverage is the same. It's regulated by the federal government. So if you buy an Aetna plan, if you buy a State Farm plan, if you buy a United American plan, they all offer the same benefits and the same coverage. So primarily you shop these companies based on brand loyalty or on price. The third area or part of Medicare is Part C, and these are Medicare Advantage plans or MA plans. You do have to enroll from October 15th through December 7th with coverage starting January 1. The Medicare Part C plan usually has an embedded Medicare Part D or prescription drug benefit. There are 5 types of Medicare Advantage plans. There are health maintenance organizations or HMOs. There are preferred provider organizations or PPOs. There are private fee-for-service or PFFSs. There are special needs plans or SNPs. And there are dual special needs plans or DSNPs. If you want more information on the special needs plans and the DSNPs, please join us on one of the Wednesday Lunch and Learns for more information. The Medicare Advantage plans have a number of different benefits. They usually have a lower monthly premium. Most of the plans that are being offered this year have a zero premium plan. They also do not usually charge a Part A and a Part B deductible. However, they have a standard fee or copay for each of these. In the Part A deductible, usually there's a $200 or $300 or $400 per day out-of-pocket expense. On a Part B deductible, oftentimes for like physician visits or specialist visits, you will have a $10 or $20 or $30 copay. Other Part B services, you'll have the 20% out of pocket, such as oxygen. They don't charge any excess fees, and usually the Part D plan is embedded. The other embedded benefit that many of them offer is a vision, hearing, or dental benefit. The vision and hearing plans usually cover a portion of the cost of hearing aids or eyeglasses, but not usually the total cost. On the dental benefit, it usually will cover something like an exam and an x-ray and maybe a cleaning once or twice a year. They usually do not include extractions or fillings or dentures or partials. Usually those are out-of-pocket costs. In a Medicare Advantage plan, you do have to use their network specialists and other providers most of the time. One of the strengths of a Medicare Advantage plan is that they focus a lot on preventive benefits, especially chronic disease management, and they also usually have some type of care coordination. The Medicare Advantage plans that we have that are offering services in Colorado in 2019 are these 9. Not every plan offers services in every zip code around the state. So you will need to check and make sure that whatever zip code you live in, though they're offering coverage in your area. The star ratings, which we often look for to help us determine the quality of care and patient experience, will not change because of COVID-19 in 2021. There are 3 MA plans that are making changes or they're leaving certain areas in 2021. Rocky Mountain Health Plans was bought out by United Healthcare several years ago, so they are discontinuing their cost plan. The Friday Company is discontinuing services in some areas of the state, and Mutual of Omaha has totally left the state. Because they are discontinuing coverage, if your plan is one of these, you have the ability to enroll in a Medicare supplement with a guaranteed issue, regardless of pre-existing conditions. Or you can enroll in another Medicare Advantage, and it doesn't matter if you have any pre-existing conditions. So the major differences between a Medicare Advantage plan and a Medicare supplement is there are differences in the premiums. Medicare Advantage is usually lower, Medicare supplements are higher. However, Part B, Medicare Advantage, many of the out-of-pocket costs are yours. There's no coverage for that. Whereas a Medicare supplement, that is usually covered. There are no excess charges and advantages. In a Medicare supplement, if there's any excess charges, that's usually covered. In a Medicare Advantage, you usually have to use their contract physicians and specialists, the network, whereas in a supplement, you can go to anyone you want to. And usually the Part D benefit is capped in a or is embedded in a Medicare Advantage. In a Medicare supplement, you have to buy a standalone Part D plan. If you are in a Medicare Advantage, they cap your out-of-pocket costs. If you're in a Medicare supplement, they don't, but it's not really, usually doesn't matter because the Medicare supplement is not capped, so it'll pay for whatever Medicare doesn't cover. Let's turn our attention now to a Medicare Part D plan, which is prescription drugs. And open enrollment started on October 15th and continues through December 7th, with coverage starting January 1. Part D plans are sold through private insurance plans, and you can have the premium deducted from your Social Security check, just as your Medicare Part B coverage, or you can have it deducted from your Social Security check, or you can send them a check every month. The Part D plans are required to cover all of the drugs in these 6 categories of cancer, anticonvulsants, HIV, antidepressants, immunosuppressants, and antipsychotics. In the other areas, they only have to cover 2 drugs in each class, and they can select which ones they want. Medicare prescription drugs plans do not cover compounded or homeopathic drugs, nor do they cover over-the-counter drugs such as Tylenol or vitamins. The Medicare Part D standard benefit did change for 2021. So the annual deductible, which will be $445, and most of the plans have that standard deductible, although a few of them charge you less. The initial coverage limit then, the cost of prescriptions at the retail level is $4,130, of which you are required to pay 25% or a little over $1,000. Once the cost at the retail level, which includes the $445 deductible, reaches $4,130, you enter the coverage gap or the donut hole. And when you are in the donut hole, again, you pay 25% of the cost of both generic and name brand drugs up until the cost of the retail price of your prescription drugs reaches $10,000. So basically you, when your retail price reaches that, you paid a little over $3,000, about $3,500 out of pocket for your prescription drugs. You will go into catastrophic, and catastrophic has changed significantly. So once the retail price of drugs is $10,000, you go into catastrophic coverage. If you use generics when you are in catastrophic coverage, if the retail price of the drug is under $74, you will pay $3.70 for that prescription. If the retail price of the generic is more than $74, you will pay 5%. So if the retail price of a generic is $100, then you would pay $5. On the brand name side, if your generic drug, or if your drug in catastrophic is a brand name, it will cost you $9.20 if the price of the drug is $184 or less. If the price of the drug is over $184, you will pay 5%. So for example, if a drug is $200, you would pay $10 because that is more than the $9.20. If the price of a retail, if the retail price of a drug, say you have for a chronic disease, is $10,000, then you would pay 5% or you would pay $500. And that is a major change this year. The companies that are selling Medicare Part D plans are these 9. And they have to sell in all counties of the state, regardless of the zip code. You can purchase a Part D plan online, or you can go through an agent, or you can call 1-800-MEDICARE. Medicare Part D highlights: the cheapest plan this year is an Aetna plan of $7.30. This is probably a plan that individuals who are not taking any prescription drugs will want to look at because it will be the most cost effective. The most expensive is a United Healthcare drug, which is $102. The average cost this year is around $44. The Medicare prescription drug plans usually have tiers, and they often have a tier 1, 2, 3, 4, 5, 6. They may not have that many tiers, they may have fewer. Often a tier 1 and 2 is generics, and they're the older drugs. You pay $1 or $2 for those. Tier 3 and 4 are often preferred and non-preferred brand name drugs, of which you're going to pay usually a range depending on what level they're on. And then a tier 5 and or 6 are specialty or select drugs. And these are usually the very expensive new drugs, and you may be required to pay as much as 50% of the cost. It's important to know that not every company puts every drug on the same tier, which is why you will want to go to the Medicare plan finder at medicare.gov, and you will want to put your prescriptions in, because some companies may have a blood pressure drug as a level or as a tier 1, whereas a different company may have it as a tier 3. And that will affect what your copay is. You also will want to select the pharmacy that you will want to use, because there's usually a difference if the drug is purchased, say, at a Walgreens versus a King Soopers versus maybe the local pharmacy in a rural community. The prescription drug plans have the ability to change the formulary every 2 weeks. If they plan to change a drug on a specific tier or drop it, they have to give you a 60-day notice. Another major change that's happening this year is the Trump administration has introduced something called the Senior Savings Model. And the benefit here is that insulin costs $35 copay, regardless of the cost of the insulin. Prescription drug plans can participate in it as well as Medicare Advantage prescription drug plans, or the MAPDs. It is voluntary. Some companies also offer it on one plan, but not necessarily on the other plan. The way that it works at this point in time is if you have one prescription for insulin, say you have Novolin, you would get that for $35 a script. If you have to use more than one vial or one script of Novolin in a month, you would only get the $35 for the first script, and the second script would cost you the full amount. At the same time, though, if you have multiple vials or prescriptions for different kinds of insulin, say you have Novolin and Humulin, then you would get the $35 for each of those scripts. The way that you can figure out which companies are participating in the insulin program is go to the plan finder at medicare.gov, turn on the filter or the sort for insulin savings, and it will give you the companies and the plans within those companies that are offering that. The companies, both the prescription drug plans as well as the Medicare Advantage plans, have the ability to impose step therapy on the different types of insulin that you can be prescribed. In Colorado, we do have a rule that says that you can only have to pay $100 per month for insulin. However, that does not apply to Medicare prescription drug plans. It does not apply to anybody in a PACE organization or in a DSNP. So if you are looking now to try to decide which Medicare Part D plan to enroll in, the way to do that is to go to the plan finder on medicare.gov. You'll need to know the drugs you take, how often you take them, and what the dosage is, as well as where you want to pick them up, or if you want to do mail order. If you put in your drugs and opened up an account last year, you can simply put in your name again and the information, and it will pull up your profile from last year. If you did not do that, you may want to consider doing that this year. You can add or take away any drugs that have changed over the year. You will then get a comparison of the prices, what the out-of-pocket costs will be, as well as the premiums for the prescription drug plans that are offering the different drugs that you are taking. When you are giving consideration to which plan to purchase, you will want to look at the following things. So you'll want to look at step therapy, meaning do you have to take other drugs before the one that your doctor has prescribed will be approved. You'll want to look at quantity limits, which means how many pills or how many scripts you can get filled on that particular drug each month. You will want to look at prior authorization, meaning does the doctor have to get approval every time that they write that prescription from the prescription drug plan. You'll also want to look at what is the deductibles and what are your out-of-pocket costs, and do they offer retail or mail order. When you have done all of that research and come to a conclusion, then you can enroll online. You can call 1-800-MEDICARE, or you can call an agent. Another thing that we're offering this year as part of Medicare Monday is various kinds of resources. And you can request a goodie bag just as you could pick up stuff if you were in person. So if you will send us your name, address, and telephone number to cogs@senioranswers.org, we'll be happy to put one of those in the mail to you. Covers or includes a number of things for COVID-19, which you might be interested in. We're also offering you the opportunity to do Medicare on the Porch. This is additional resources about Medicare as well as other services that are provided both by the Colorado Gerontological Society as well as other resources in the community. You can simply drive by our office at 1129 Pennsylvania in Denver or 5500 East Peakview in Centennial. Just pull into the driveway, grab a bag off the porch. You don't have to talk to anyone. You just grab and go. And these will be available on October the 19th, October the 26th, as well as November 2, 9, and 16. If you need any help, we'll be happy to help you. You can call us at 1-866-294-3971 or 303-333-3482. You can call us if you would like some individual counseling. You have questions about your coverage. You're trying to look at changing either your Medicare Advantage or your prescription drug plan. You really want help kind of interpreting those results. Or you just want help with the plan finder because you don't have a computer or whatever, you can give us a call again at 1-866-294-3971 or 303-333-3482. We're also offering the opportunity that you can have an individual consultation with the University of Colorado School of Pharmacy student, and they are doing drug reviews, specifically looking for things like drug-drug interactions, looking at the prescription drug plans that you're currently enrolled in, looking if they can save you some dollars, etc. They're available to do Zoom calls, and we have limited appointments. So again, call the numbers on your screen at 1-866-294-3971 or 303-333-3482, and we'll be happy to give you a call. Thank you for joining us today at Medicare Monday, and we look forward to serving you.